I'm Dr. Prince Chirwa from Malawi, currently doing Postgraduate Diploma in Diabetes under Merck Foundation Scholarship. I work as a District Medical Officer in one of the district hospitals in Malawi, in the northern Malawi. As a District Medical Officer, I work as a head of clinical services in the district. And most of the population that I'm serving are from the rural Malawi, where access to health services is very difficult. So having embarked on the diabetes course, there are a number of things that I've learned and a number of things that I'm implementing on the ground. That's both to the health system as a whole and even as far as patients are concerned. As already highlighted, I work at a district hospital, which also acts as a secondary level facility, meaning that we have small facilities that refer cases to the district hospital. We also refer cases to a central hospital in case we need a specialist opinion. So when I started the course, almost all diabetes patients were coming at our district hospital to access care. And on every Friday, we usually have a clinic, which most of the times on average we see 300 patients against 3 clinical team, which is difficult to offer quality services. So after learning the course, or having started learning the course, I became confident to such a point that I've been able to teach some clinical people from the smaller facilities, which is ongoing, of course. And since that time, we have managed to reduce the number of diabetes patients who are coming to access services from the district hospital, which is very far from where they're coming from. So the patients are able to access services right in their closer to their homes, which is the whole essence of universal health coverage. Secondly, I noticed that in our clinics, most of the times when we're giving our care, we are mostly focusing on giving medications. But during this course, I have learned that when we're giving diabetes care, it's more than medications. We also have an aspect of patient education, which is key if you're to have good outcomes in as far as diabetes patients are concerned. So after learning this course, we've introduced a session almost in every clinic on a Friday where we do extensive patient education, which is also continuing when the patient meets a doctor in the clinic. So we've seen that since the introduction of the patient education, we've seen an improvement in knowledge in terms of care that is given to diabetes patients. This care which I'm talking about is the care beyond the hospital, where when they've gone home, they're able to take care of themselves. They know what they're supposed to eat. They know when to take their medications. They know what lifestyle they should lead, so that in the end we should have a good outcome. And so far, we've seen improvements in terms of control of blood sugars. On another note, this course has also opened my eyes in terms of potential areas for research in Malawi. I will only concentrate on one. Like during the course, there was an aspect that I learned about depression in diabetes patients. This is an aspect that we as an institution, I think, have overlooked for a long time. So after having learned that one, we as a team here, we decided to do our own research, which is currently ongoing, where we're looking at the presence of depression in patients with diabetes. We want to see how we can incorporate the aspect of mental health in our clinics, not only for diabetic, also maybe hypertension and any other non-communicable disease clinics that we do here. So yes, this course is very important for us, and I believe as I continue the course, I will learn a lot of things. One last thing that I think is also important to mention here is that during the course, I've learned a number of new things, a number of new drugs that are supposed to be there, and a number of new tests that are supposed to be there. Malawi being a resource-limited country, we may not have these things currently. But I may say that at the district hospital, as a head of clinical services, we usually have a drug budget that requires us to procure the necessary equipment and essential drugs. So through these things that I've learned in this course, it has given me a direction in terms of what tests to procure, in terms of the new evidence-based tests, and even where priorities are supposed to be. Otherwise, before this course, we are only concentrating on the basic tests that we can do in our setting, but we see that with the resources we have, we can even do more. So yes, it's been a pleasure doing this course. Thank you.